Questions, comments, please let me know. I'd love to help. Other than that, keep working hard, keep studying hard. Let's get to our questions. 131. Jason loves dark chocolate. It serves as a strong reinforcer, but tends to cause cavities. Jason's mom now praises Jason whenever she gives him a piece of dark chocolate. Jason's mom is attempting to create a what? Pretty common scenario. Edibles, there is an ethical qualm with using edibles that we need to consider. Things like weight gain, cavities, for instance. Is it natural to continue giving dark chocolate to Jason as he continues to strengthen his skills and learn new skills? Maybe not. So what mom is doing is she's now taking praise and combining it with dark chocolate. What is she trying to create? Is she trying to create a primary reinforcer? Well, primary reinforcer is something unlearned, something we're born with, and we know praise is learned. It's conditioned. It's a secondary reinforcer. Takes us to B, generalized conditioned reinforcer. That's what we're trying to create here. Praise is one of the most common types of GCRs, this generalized conditioned reinforcer. And by pairing it with a previous reinforcing stimuli, she's trying to create her own reinforcer. A conditioned reflex, that would have to do with respondent behavior. Whenever you see this word reflex, we're talking not about respondent behavior here. And then stimulus, she's not creating a stimulus. The praise is already a stimulus, right? She's just trying to pair it with the dark chocolate to give it reinforcing properties and to create a generalized conditioned reinforcer. 132, a BCBA who is also trained in traditional talk therapy puts out the following advertisement. Now accepting clients, we provide services for the mind, body, and spirit that are rooted in the principles of behavior analysis. Has the BCBA violated any part of the ethical code? Let's be real careful here, okay? This is straight from the new ethical code. What is the BCBA advertising? It's advertising their services. They're both a BCBA and a talk therapist. But do they specify what they're going to give their clients? No, it's vague. We're going to give services for the mind, body, and spirit rooted in the principles of behavior analysis. So are we doing behavior analysis, or are we doing things like mindfulness and spirit training, right? Or spiritfulness, or working on mentalisms, right? The BCBA needs to be very clear in their advertising what they're offering, okay? Because yes, they might be trained in traditional talk therapy, but when they're representing themselves as a BCBA, they need to be adhering to all of our BCBA principles, right? Our code, our ethical code, and we cannot mix the two. So we need to be very clear. So has the BCBA violated any part of the ethical code? A, yes, they are not allowed to deliver non-behavioral services. Well, that's not true. If they are trained in traditional talk therapy, certified, etc., they are absolutely welcome to provide talk therapy. They just can't advertise talk therapy without being very clear about, are they giving behavior analytic services or are they not? Okay, that's what the ethical code is saying. You need to be very clear, what are you providing? B, no, this advertisement is acceptable. It is not, for all the reasons we just talked about. C, yes, they must distinguish between non-behavioral and behavioral services. Yes. Behavior analysis on the body, right? That sounds close enough to maybe operant behavior, right? Observable, measurable. But now we're talking about mind, spirit, things not so observable and measurable. Okay. And it's not very clear in their advertisement. Straight from the ethical code, they have to distinguish between non-behavioral and behavioral services. And then D, yes, you cannot solicit clients. No, you're able to market. There are guidelines, but yes, you can market your services. 133, a fixed ratio 2 schedule is implemented initially for all discrete trial teaching conducted with Olivia, a 6-year-old client. Olivia is a quick learner and begins mastering programs rapidly. The FR2 schedule is changed to a VR5 schedule, and Olivia's performance suffers as a result. What is potentially occurring? This is the question you should be able to answer, even if you had no answer choices. What is happening in this question? Well, we have a 6-year-old using an FR2 schedule. Quick learner, master programs rapidly. We change it to a VR5. VR5, the response requirement is significantly different than an FR2. In FR2, every 2 responses, you are getting reinforcement. A VR5, who knows how many responses are required before you receive reinforcement? You thinned the schedule extremely quickly, and now Olivia's performance is suffering. What do we consider this? Well, A, the schedule became too thick. Did we thicken the schedule? No, we thinned it, right? If we increase the response requirement, that's thinning the schedule. We're fading it. B, Olivia is lacking motivation. It's not clear if she's lacking motivation. She's a quick learner, begins mastering programs rapidly. Nothing in this question indicates that her motivating operations are being manipulated or changed. C, Olivia is experiencing ratio strain. Yes, this is what we consider ratio strain. When we thin or fade too quickly, causing responding to decrease or to limit, we are experiencing ratio strain. And then D, the behavior program lacks generality. We're not talking about generality in this case. We're talking about Olivia experiencing ratio strain, going from an FR2 to a VR5 schedule. 134, you just passed your BCBA exam last week and are hired as a behavior analyst at your local ABA agency. On your first day of work, you observe your boss asking your clients to provide reviews on Yelp for the agency. What should you do in this situation? This is a soliciting testimonial question. The ethics guidelines are very clear about soliciting testimonials from current clients is you shouldn't do it. Okay, so what should you do in this situation if you see your boss asking clients to provide reviews on Yelp, soliciting reviews for Yelp? A, nothing. You're not obligated to act in this situation. Incorrect. As a behavior analyst, you have to conduct yourself in a manner becoming of the ethical code. You have to represent our industry and behavior analysis well. You absolutely are obligated to act in situations that you deem unethical. B, wait and see if the behavior happens again. If it does, take necessary action. We don't wait and see. We should respond in the moment. Now, we should respond appropriately, but we should definitely respond in some way. C, request permission from your boss to start obtaining reviews from your clients. No, you don't need to follow in their footsteps and engage in unethical activities yourself. You should D, attempt to remediate the situation and document what occurred. So you try to explain to your boss the code, right? What the code says, okay? Document what occurred and go from there. D is our answer. 135, when conducting a functional analysis using applied behavior analysis principles, which of the following is considered the control condition? Easy question. On the exam, okay, people who fail the exam a lot of times get scores like in the 370s and the 380s, right? Which means you get a good chunk of questions right, because there are a lot of easy questions on the exam. It's a long exam, right? So not every question is going to be hard as can be. And when we get to easy questions, we need to not overthink it. So when we get a question like this, what is asking us about the control condition in the functional analysis? Well, we should know this. You should just know that, right? Is the control condition the alone, the play, the social, or demand? Well, it's obviously the play condition. Alone, social, and demand are all types of conditions, right? But the control is play, where everything is free. There's no manipulation. There's no demands placed on them. None of that. We're just getting a control condition, getting some data, okay? Observing the client in this play stress-free environment. 136, an assessment is conducted on a 16-year-old client with good communication skills. The assessment determines several areas of need. Each area is about equal in terms of priority and social validity. In order to determine what you should target first, you could what? Okay, kind of tricky, right? What is going on in this question? Well, we want to determine what we need to target first. Problem is, every area is about equal in terms of priority and social validity. Several areas of need, a lot of places to start and choose from. What should we do? What can we do to pick the best? A, consult the client on what they would like to work on first. Absolutely. That is extremely important, right? Hey, we have all these things we can work on. What do you want to choose first? This is a great situation to be in. They're all equal in terms of priority, all equal in social validity. Now we just need to decide where to start. Asking the client, a 16-year-old client with good communication skills, to pick what they would like to work on first. Not only are you giving them choice, okay, you're now involving them in treatment planning. A looks pretty good. Can we find a better answer? B, pick an intervention at random. No, we need to be data-driven, right? C, ask a coworker what they would work on first. Well, the coworker is not necessarily involved in the case. And especially if you're able to ask the client, you're going to go with the client over the coworker. And then D, start taking data on all areas at once. That might be not feasible given time or social or resource constraints. Who knows, right? There's several areas of need. Starting to take data on all areas at once, not the best, right? We're going to pick a few targets at first, okay? And the best way to determine what we should target first, absolutely first, is A, consult the client on what they would like to work on first. Now, again, we're picking the best answer out of the available answers. That's how you should be approaching the exam. Don't fight the exam, okay? The exam is going to give you enough information to answer the questions using the answer choices that you are given. 137, a special education teacher at Glenn Taylor Elementary teaches a class of 10 students. This week, the teacher starts working on safety skills, including crossing the street and discriminating between strangers and non-strangers. The special education teacher sets her mastery criteria at 90% for these skills. Is this acceptable? So this is really an ethical question, right? We're talking about client dignity. We're talking about social validity. And if we're training our client to cross the street effectively 90% of the time, is that okay? Well, obviously not. And discriminating between strangers only 90% of the time, obviously this is not okay. What about the other 10%? A, yes, 80% is the gold standard for mastery, so 90% is above and beyond. 80%, yes, is what most people use for mastery, but it doesn't mean it has to be, okay? Especially in this situation, we should be achieving 100% for client dignity purposes and for social validity, meaningful purposes. B, it depends. Each student is different, not when it comes to safety skills like crossing the street. C, no, the students should be able to perform these skills whenever necessary. Yes, if you need to cross the street or you need to discriminate between strangers and non-strangers, in order for us to have effective treatment, right, we need to get to the point where they're doing this anytime is necessary. And then D, there is not enough information to determine acceptability. That's not true. We can definitely determine acceptability. Our answer is going to be C. No, the student should be able to perform these skills whenever necessary. 138, precision teaching is a common method of teaching used in applied behavior analysis. Precision teaching focuses on what? Okay, we left the precision teaching questions in because we thought it was important, even though they're not specified so much on the task list. We still want you to be aware of direct instruction, precision teaching, these type of things, because they might use this language on the exam, okay? You need to just be aware of the different types of teaching in ABA. And precision teaching is one of the most common methods. What do we focus on with precision teaching? Choral responding is more with direct instruction. Precision teaching is really focused on fluency, right? We have our standard acceleration chart. We're trying to teach to fluency, okay? We're tracking rate of fluency over and over again, trying to achieve a certain goal. Generalization, no. Self-pacing of instruction, no. Precision teaching is commonly focused on fluency. 139, after working together for 5 years, you and your best friend, who is also a BCBA, decide to open a residential living facility for adults with disabilities. You and your friend both have significant experience designing treatment plans for adults and are competent in all areas of adult behavior management. All of your plans up to this point have been successful. Your first client at the residential facility is extremely similar to a client you worked with 2 years ago. How should you develop the treatment plan for this new client? Very important question. You don't want to fall into the trap of BCBAs who reuse same treatment plans over and over and over again because it worked once. Everything we do should be based on a new assessment, personalized to that client. All right. So in this case, what are we asking? Well, you're asking, how do you develop a treatment plan for this new client? Well, the new client, right? Well, your first client at the residential facility, right, is extremely similar to a client you worked with 2 years ago. So this new client is nearly identical to a client you had 2 years ago. Do you just go in and reuse the client's treatment plan from 2 years ago? Definitely not, right? How are we going to develop the treatment plan? A, implement the treatment plan that worked for your other client and adjust as you gather more data. No, right? We need to make it personal. We need to do our own assessment. So B, conduct an assessment on the new client and base the treatment plan on your findings. Yes, this is what we're looking for. Okay. We want to treat this client brand new. Now, can you draw inspiration from what worked in the past? Definitely, right? That's what we're trying to achieve, right? Behavior analysis, we're really experimenting over and over again to find out what works and what doesn't work. So can you use interventions you've used before? 100%. Can you copy the treatment plan? No. C, allow the client who is a consenting adult to pick their interventions based on a predetermined package of interventions you provide them. What's wrong with C? What's wrong with C is this idea of a predetermined package. Again, we're not personalizing. We're not conducting an assessment. Okay. We're just going in there cookie cutter style, which we should not be doing. And then D, implement the treatment plan that worked for your other client and compare the results. Again, we're trying to avoid that. The best way to go about this would be to conduct an assessment, brand new, on the new client, base the treatment plan on your findings. And then 140, sometimes you find yourself scrolling through Instagram and TikTok for hours at a time. You don't even realize it until it's too late. Your feed constantly updates with new content. Every second or third scroll, you stop and like a post. What type of reinforcement schedule are you on as it relates to liking a post? Okay, basic reinforcement schedule question. Are we looking at responses or time? We're looking at responses. So what can we eliminate? We can eliminate interval schedules. That's where you should start with basic reinforcement. So now we have fixed versus variable. Fixed means the amount doesn't change. Variable means it's going to be an average. Well, if you like a post every second or third, now we're looking at an about or an average. So what type of reinforcement schedule are you on? VR. Okay, every second or third scroll, you stop and like a post.